It is
Yes, it's
recording.
recording.
Mm-hmm.
It's
Now I can
recording.
Mm-hmm.
be recording now. It just take a while to come up. All right.
Hi, Helen.
Okay.
Hi, Helen.
Hi, how you doing?
Good. How are you doing?
I'm fine.
So, what bring you here today?
I came here today because I'm having some issue in my family and I've not been able to sleep and I'm having problem with anxiety, like dizziness and all this stuff. And I've been to the hospital a couple of times now and they couldn't find anything going on with me and I was cleared. And just of recent, I discovered that my grandson is involved in some drug, and that really bothers me. And since then, I've not been able to sleep. And when I try to confront him, it looks like it's an issue. So I decided to see a therapist, and then they refer me to come to this group.
So, Ellen, also you come to this group because you have not been able to sleep, and or what is it really bothering you? Is that your grandson's behavior, or because you're not able to sleep well?
I think my grandson behavior is part of the issue because whenever I think about him, I get frustrated, agitated, and uh, fatigue. So it really bothers me and it's affecting me a lot because this is my only grandson.
So he's your only grandson. That means you're very close to him, or?
Yeah, he's very close to me, comes to me all the time. And when he needs something, he comes to me. I'm able to communicate with him better than even my own daughter. And but now it's very far to me. He doesn't come close to me. He doesn't communicate. When I call him at times, he doesn't pick up his phone. I don't really know what's going on with him out there. And I'm very disturbed. I'm very bothered. And I'll appreciate if I can get some help for him so that he will stop dealing with the drug that he's in. He's just 17 years old and he's a little boy. So this really bothers me and it's affecting my health. And, you know, so I just need some help if there's anything you think you can do to help me with this situation.
So do you think if there is an improvement on his behavior, that would also make an improvement in your health?
I think that will make me feel better because I'm not going to be thinking too much about his safety out there because his safety is very, very important to me. And you know what is going on around, you know, the world now. All these kids dealing in drug, killing each other, and that really bothers me. And I think if he can listen and change, that might really, really help me as well.
And change. So what kind of change, Helen, would you like to see?
The changes I would like to see in him is to be able to communicate with him the way we used to communicate, and also to go to school on time, to be very obedient, and you know, to not to go out hanging out with gangs and all those people that he has been following. And I think if all those things come in place, there will be a lot of changes in him.
Okay. So, but you said you have not been able to sleep. Have you been taking any medication to help you sleep, or?
Actually, I've been taking this medication for a couple of years now. The doctor gave me this drug that is called Activan, and it's PRN as needed, but I don't supposed to be taking it every time. But now I'm taking it every time thinking it's going to help me to sleep. but it's not helping. It's not doing any help. He said it's getting worse and worse. So the medication is not helping me either. And I've been on this medication for like 30 years now. And just because the issue of my grandson, uh,
So have you been taking the med for 30 years just for insomnia, or other, you've been having other issues with that?
just having like anxiety,
Oh,
depression, you know, and
okay.
grandson coming into the picture again is making it terrible for me.
So in the meantime, did you talk to your doctor, the prescriber, about changing the medication, maybe switch it to try a different one?
Actually, I spoke with my doctor, and he said he was going to order me. He gave me this medication called Bipropine, and
Buspar?
yeah, but
Mhm.
that medication is making me sick. I don't think is helpful to me at all.
How long
So
you been taking this new medication?
I've been taking it for like probably a couple of months now, like 3 to 4 months, and it's still not helping.
Is your doctor aware about it?
Yes.
So would you like the doctor to change that to another one? Because you can always try until you find the medication, the proper medication that helps.
Well, right now I don't really know if the doctor can change it. That would be fine. But I really believe medication is not my it's not going to help me right now, because I think I need something to relax me, and and let if my grandson can stop the stop this bad behavior, that would really probably that might be of help to me. And if there's any medication that is helpful, that will be of benefit as well.
Okay. And what other techniques have you tried to help you sleep? Do you take only medication pills, or you try other techniques like um, maybe like warm shower before you go to bed, tea,
um,
things like that? Have you tried anything else?
I've tried I've tried trying to make sure I do some exercise in the daytime, so I'll
Mhm.
not just idle. Do
Right.
some exercise so that I'll be tired and be able to go to sleep. I'll be able to sleep in the nighttime. And also I've tried to drink like warm milk and
Mm-hmm.
hot shower. That helps a little bit, but probably I sleep for like 4 hours and I'm up again. And I know that I'm supposed to sleep like 8 hours, which I
Mm-hmm.
think is going to be helpful to me. So I'm just trying to see if I can seek help for my grandson, and also that will also help my health as well to improve.
So how often do you see your grandson?
Actually, since I spoke with him uh, with this situation, I've not seen him for the past 1 month now.
Oh, wow. So how would you like to meet him? Is there a way you think you can meet with him?
Um, the only way I think I can meet with him is probably to go to his school, you know, and also if you can get in touch with him, because I told him already I'm going to talk to a psychiatric that can help with this issue, and I think he's willing to seek for help. But right now, it looks like he's in the stage of denial. He's still denying, but I think he's ready to seek for help.
You said he's ready to seek for help. That's a good sign.
Yeah.
That's a good sign. So is there anyone from school, like counselor, school counseling? I know they provide that. Have you tried to talk to anyone
Actually, I spoke with
from his school?
the school counselor. He referred us to your company, and that's why I'm doing this therapy with you guys.
Yeah. Is there any way they can help your grandson in the meantime? You are seeing us
Well, they said right now there's nothing they can do
for him.
for him
I see.
because in school they can't, their discipline is very low, so
I
they believe the parents have to take care of that issue.
I see. Helen, in my opinion, I think if you could try to invite him to one of the therapy session with you, so maybe he doesn't really know what you've been going through. He doesn't understand your situation right now, or he doesn't understand how his behavior have affected you. So maybe you would try to invite him to one of the therapy session with you. What do you think?
I think that sounds good, and I'll try to do that. I'll try to convince him. I'll call him. I hope he's going to pick up my phone, and I'll try to convince him to see if he's going to come with me. And if not, I'm going to let you know. Probably I'll also give you his number, and I'll let him know that he might be expecting call from you. We might give that a try and see what's going to happen.
Okay. So our next meeting next week, would you be available to try to come back next week or in 2 weeks? Or
I think 2 weeks will be fine because
2 weeks would be fine. Okay. In the meantime, I would like you to speak with your prescriber to see if you can try a new medication
okay.
to help you sleep. And have you been feeling sad or depressed? Do you stay in bed? Do you stay in bed not able to do your daily living activities, or you just cannot sleep at night? I understand if you don't sleep well at night, you might not have enough energy for the day to go through the day. So how you been feeling?
A little bit depressed and sad.
Yeah. So I would like you to talk to your prescribers about that, and maybe you can try a new medication and stop the Bospor, because Bospor doesn't work for you.
Okay.
And I would like to see you in 2 weeks. I'm asking you to try to talk to your grandson. Invite him. Just invite him. Just let him know that you would like him to come with you.
Okay.
Because he might not want to seek for therapy at this time, but maybe he would come with you because you're not doing well.
Okay. I'll appreciate that. I'll try and do that.
So I will see you in 2 weeks.
Okay.
But before that, I want you to try to get some help from your prescribers.
All right. Thank you. I'll do that.
Okay.
Very good.
All right. Thank you.
Well, so Alex, what do you think?
I like the interview. You asked in detail questions regarding her scenario, and you were going into, you were asking those open-ended questions that were necessary for you to formulate a good mental health care plan with her, and know in detail what was going on in her life and what was making her feel fatigued, or what was making her feel sad as well, and you explored her depression, and also the pharmaceuticals that she's taking, which is very important in the therapy session. That's something that we should highlight too as well, what pharmaceutical she's currently on, so we can know why was she prescribed those medications.
Right.
So
Okay.
I like that.
Okay.
Also liked how you went into detail with her grandson, what he was doing, and you explored, you found that that the grandson was trying to find help. She told the patient told you that the grandson did look for help for his drug use, and so you were able to jot that down and see if he can get counseling at school with the counselor, and find out if he can get help, in his own and with his counselor there at school, which can help him out. And that plays a role to, in this scenario that his grandson and the patient both play a role to improving their overall health, their mental health.
Right.
So you knew that her grandson getting help simultaneously as the patient getting help from you can improve the entire situation. So that's what I really like that you explored on her outside living with her grandson.
Because sometimes they don't want to seek for help for themselves, but if they understand how the behaviors are affecting the parents, sometimes they go, okay, I'll go with you, but keep me out of it, but I'll go with you.
Yes, exactly.
Yeah. Okay.
And the therapy section, do they meet? Did they supposed to meet every 2 weeks or once a month?
Most of the time I have individuals I work with, so they go every 2 weeks. Depending on the situation,
Sure.
on the condition, I would say, they would go every 2 weeks. Most of the time, every 2 weeks. Or if they don't, every 2 weeks or once a month. But my individuals, most of them go every 2 weeks.
And regarding communicating with the prescribers of the medications that the patient's taking, can you get their file? Can we obtain their records regarding why they're in the prescription? What were their assessment findings?
Right. As far as I know, we are doing this as a student for psychiatric mental health nurse practitioners. So that means we are going to be able to also prescribe those medications. But the counselors the other counselors that I know, they are not prescribers.
Okay.
They are not prescribers.
The counselors don't prescribe.
No, they don't prescribe.
Only the psychiatric doctor can prescribe. They're just going to give counseling, educate them and, tell them what they have to do and, just to give them more encouragement. Yeah. But they cannot prescribe medication. Only the doctor or the psych nurses can do that.
We're like both worlds integrated into one.
Yes.
Yes. We're a counselor and a psychiatrist.
Yes. Yeah, that's true. That's true.
That's what makes it very interesting. Yeah.
Well, I think.
Yeah. But they do have access to the patient's medical record.
Okay.
They have access.
Yes, because the patient she's on lorazepam, and she tried the bupropion, and she said she went through a hyponatremia. So we'd like to get the specific statistics, the data regarding those medications, so we can know if it's, just to have a.
Yes. So for hyponatremia, so now that's, the prescribers, I don't need psychiatric, you're going to have to run some blood to see how low the patient sodium is and what recommendations they're going to make. Because now, is it just stop the bupropion is going to make the sodium, going to improve the sodium, or they have to add some? I don't think they would need to add it. Or was that the condition, or was that condition there before bupropion, but they were overlook at it? Maybe they were not paying attention that the person was already hyponatremic.
The way before.
Probably
bupropion made it worse, maybe.
Probably they need to do some blood work. And probably the patient is not eating.
Exactly.
Yeah, the patient is not eating enough to have enough sodium. So that makes the sodium drops. So it's affecting every part of the system.
And also,
physically, everything is being affected.
Right. also, besides sodium, what other medication that this patient is taking that could cause the sodium to go low? Are you taking Lasix, like are you taking some medication like Lasix, or some medication could cause it besides Bospar?
Mm-hmm.
Maybe that's when we would need to have some medical information and data to compare like some blood work and compare new blood work with old labs to say, how was it before you started on Bospar? How was your sodium level?
Yeah, as that, just as you said, the patient might be on some other medication.
Yeah,
that we don't know, because we only know the psych medication. Those are the two.
Exactly. Right.
So
yeah.
He might be on other medication that might be affecting her as well, or maybe they are contraindicating each other, adverse reaction, something like that, that the doctor himself or whoever the doctor is might want to change those medications after getting the lab work and doing all this stuff.
Right.
So all these two we have to put into consideration when we're doing our therapy.
Right.
Yeah.
Great idea.
Yeah.
So they can be getting a prescription from the psychiatrist, prescription from their doctor, and maybe they don't have a record of the medications they're all taking together.
Yes.
Once saying, okay, well, let's stop this medication, the psychiatrist could be stopping this medication because it's dropping your sodium levels, but he doesn't know that she's on Lasix as well, or they didn't get the right, the pharmaceutical regimen that she's on.
Yeah. That's why both the medical doctor and the psych doctor have to check the patient diagnosis, the patient's mental status, and anything that is going on at that time. Both doctors have to check. So everybody it's like a teamwork. Everybody have to put the doctor have to fix the medication that he or she have to fix, and then the psych doctor as well have to fix their own. So when both of them work together, it makes the work easier and balance everything up. So that's the way I do see that they do it at my place of work. The doctor does their own part, the psych people, they do their own part as well. So that helps, because the psych cannot only do their part and the doctor don't do their part. It's going to still affect the patient.
Right.
Yeah, I completely agree.
Okay. All right.
Okay. That was a good therapy session.
Thank you. I think it was
So
good.
do we still have more minutes left?
I don't know how much we have. How many?
It doesn't tell me here on my end how much we've been recording.
It doesn't tell me.
It doesn't tell me either.
Maybe it's going to 40 minutes.
Yeah.
Okay.
Do you want me to pause it?
Yes.
Okay.
Because I think we need to